If you've heard about pelvic organ prolapse, it's probably been in whispers or during an anxiety-filled Googling session. We get it. Prolapse can seem really scary. On today's episode of Taking the Floor, we cast those fears aside and hear from a Hinge Health member about her own experience with prolapse and how things have improved since she's started down the road to recovery.
I was weirded out and I started Googling, that's not the best thing to do, but it was what I had in my hand and I thought okay, this may be a prolapse.
Welcome to Taking the Floor, the podcast from Hinge Health about pelvic health, movement, and taking charge of your well-being.
We are your hosts, Kandis Daroski
and Bijal Toprani.
And we're both pelvic health physical therapists here at Hinge Health. Thank you for being here. Today, we're talking about pelvic organ prolapse. It's one of those concepts often associated with childbirth or aging that can really spike your anxiety. The idea of your abdominal organs shifting out of place just sounds so unsettling. If pooping is the pelvic floor problem we're too embarrassed to talk about, prolapse is the pelvic floor problem we're too scared to talk about.
We completely get it, but knowledge is power, and we know that learning more about prolapse, both why it happens and most importantly, what you can do about it, is the best way to calm those fears and remember that you can take charge of your own well-being. We're going to hear from a member named Blanca today about her own prolapse journey. Just a note here, you'll be hearing a lot about pregnancy and postpartum because that's true to Blanca's experience. But that isn't the only thing that can contribute to prolapse.
So Blanca started using Hinge Health during her pregnancy with more of that prevention mindset. She wanted to stay active and avoid those pregnancy aches and pains that we can all get. But after she gave birth is when her pelvic health issues really kicked into high gear. And that is where we're going to pick up with her story today.
I feel like I wasn't having as many issues when I started. I was just trying to prevent, and it did help me when I started doing the exercises. But then after I gave birth is when I started noticing that I might have a prolapse, and that's when I saw my physical therapist in the Hinge Health app.
So Blanca's PT agreed that she might have a prolapse and suggested she see her OBGYN about it, and we'll hear more about that in a minute. Now, Kandis, I wanted to ask you a quick question. I know that some people may think that you can do work during your pregnancy to prevent pelvic floor issues postpartum. Is that a myth, or what's the reality about that?
Yeah, thank you so much for highlighting this. I think the really important thing to mention is that every birth experience is just so different. It's really impossible to predict what exactly may happen on that day. So for me, rather than saying working on pelvic health prior to delivery helps prevent pelvic floor issues, I just really believe that it's better to think of it as really laying down that great foundation for recovery in that postpartum period. And postpartum is really about just that, it's about recovering and rehabbing and just kind of getting back to a new way of life. But this can be really hard, and sometimes people can really have a tendency to want to rush to get back to their usual routine.
So when I went to the 6 weeks appointment, I was cleared out for exercise. They didn't do a pelvic exam at that time. And I just asked hey, can I go back to exercising because I am an active person? And they just said yes. And I was like, okay. So I went for a run and I felt weird. I felt like there was something there. I cannot, it's I had a weight, a little weight. It wasn't too much, but it was a little weight. And I was like, I didn't feel like this before. So I was weirded out and I started Googling, that's not the best thing to do, but it was what I had in my hand. And I thought oh, okay, this may be a prolapse. I also tried to, get in there myself and try to see if there was something weird. And I was yeah, this doesn't feel like it used to feel. So that's how I noticed it could be a prolapse.
So Blanca mentioned her 6-week appointment and being cleared for exercise by her doctor, but she also mentioned that she didn't have a pelvic exam at that time. And this actually feels really common, and I can personally say that I have experienced that situation as well with my past two births. Why do we think this happens, Bijal?
Yeah, I know. That's a big question because we really want like a thorough checkup at the 6 week appointment, right? And want to make sure everything's going, as it should. But really checking things like pelvic floor healing and intra-abdominal pressure management and things like that. Even looking to see if you have a diastasis, which is a separation of those abdominal muscles, is not necessarily something that your OB is going to check at that 6 week appointment. And that's really just because they're really looking at this more from a medical lens. So the focus is really to make sure that you don't have an infection and that your vitals are good and that there aren't any glaring red flags in your postpartum recovery. And also, Candace and I, we get an opportunity to talk to a lot of MDs and OBGYNs during our clinical practice. And we've had some candid conversations, and a lot of times we hear that, really focusing on the muscles of the pelvic floor is a pretty limited part of the curriculum in medical school. There's just a lot of other focus. Whereas for PTs, our entire curriculum is about muscles. So we're always in that mindset of assessing muscles and really seeing that things are healing from that sense. So it's just kind of two different worlds within the medical field. And that's really why that 6 week visit is assessing some other things rather than assessing, how your pelvic floor musculature is really coming along.
So well said. And, it can be hard because you do kind of want that thorough exam and you kind of want, the answers to some of the questions that you have. And I just wanted to mention that it's definitely okay to go to Dr. Google. We get it. I am guilty of this as well, but it's always really important to take what you find online with a grain of salt, and really best to just kind of run it by your health coach or your physical therapist to get the real deal, because otherwise things can start to feel really scary.
It was scary because I thought it was something that I was not gonna be able to fix. Like, a little background, my grandma had like a huge prolapse that she never treated, and she almost got surgery for it. But she didn't want to get surgery, so that was just like, it was a stage 5 prolapse. And I was scared like that something like that could happen to me. Of course, I knew that she never went to physical therapy or anything, but it is scary, and it is something that almost nobody talks about. So you don't really know until something like that happens where, the organ's falling out and you hear that somebody might get surgery. But other than that, yeah, it's scary because you feel like you're the only one going through it. And the stories you've heard are probably just so bad that you think it doesn't have a solution.
I'm so happy that she really was expanding on the fear around prolapse, because it definitely does sound scary. And it can be, I think, a little more reassuring when we just actually describe what prolapse is compared to maybe what we think it is. So I'm going to go ahead and do that just to hopefully take down the tension a little bit in this conversation. I've had so many women who have actually thought that prolapse meant the organ itself, like maybe let's say the bladder, was going to actually fall out when they had a prolapse. And prolapse itself is when one or more of those pelvic organs, so again, let's just use the bladder as an example, drops down from its original positioning in the pelvic cavity and makes it kind of bulge into the vagina or the vaginal canal. So depending on the severity of your prolapse, if you are feeling something that is outside of your body, it's really that bulging into the vagina that you're feeling and not the actual organ that is about to, fall out into the toilet or the floor or something like that. So everyone take a deep breath.
No, I really appreciate you easing some of that tension around that, because I have heard it explained that way, that it's actually falling out, and that is a super scary thought. Something to note as well is that while prolapse risk is higher during pregnancy and after childbirth, a prolapse can occur from other reasons as well. Some of those things are things like lifestyle related factors like smoking or long-term engagement in high impact sports. It can also happen due to chronic constipation because of the straining that people often do to empty their bowels. And so we don't mean straining once, it's doing that repetitively over a long, long period of time. It can also occur during menopause as well due to weakness that can occur from hormonal changes. And you can also see some of this occur if you've had a hysterectomy due to the surgical procedure and some of the impact that the surgery can have on your pelvic floor musculature.
I also just wanted to say that if any of this is sounding familiar to you, that you are definitely not alone. I think the statistic is something like 50% of women have some level of pelvic organ prolapse where those organs have shifted from their normal position. And, it's really quite interesting as a provider because people will describe this as many different sensations and feelings. And so for some, it might feel like heaviness or that kind of weighted feeling that Blanca described. But for others, it might feel like pressure. It might be difficulty having bowel movements. It could be issues with their urinary leakage or frequency. So it's just really important that as we, kind of continue talking about this topic today, that we remember that there is kind of a variety of symptoms, and those are the really important things to bring up with your healthcare provider when you take that step to do so.
Prolapse is one of those topics that can be really hidden or weird for people to talk about, even more so than leaking or bladder issues. And that can make it hard to bring up at the doctor, which can then affect whether or not you get treatment. Here's how Blanca felt about it.
I feel that I was not the most comfortable saying I think I have a prolapse. Also because sometimes you say you think you have something and people look at you like how do you know, how so I don't feel like it was necessarily comfortable, but since I had talked to my physical therapist from Hinge Health before, I felt a little bit more confident because she had told me yeah, what you're describing does sound like this. Obviously she could not see me in person, but it was easier because I had that backup in my mind, hey, that she validated what I'm feeling first, so I could go ahead and talk to the doctor about it. So I did that, and I feel like he did take it seriously, and he did the pelvic exam. He said I had a stage 2 prolapse, and that to go ahead and keep working with my physical therapist, and then that then we would reevaluate in about 3 months.
Yes, and if you guys could see me, I'm doing my little PT happy dance because this is what education and self-advocacy are all about. It's figuring out what you have going on, getting support, and finding the right providers who will listen to you and take your symptoms seriously.
So let's hear a little more about what working with a physical therapist was like, since a lot of members have some questions about that.
Right after I went for that run and I noticed that I might have a prolapse, I was kind of freaking out when I first got to talk to her, but she made me feel so comfortable. Honestly, she was super nice, and she was validating everything that I was feeling, and I felt better because I was okay, first of all, I'm not crazy. What I'm experiencing, it's real and it happens. And also she made me feel more calm because I said, I thought it could be something that didn't have a solution, or that I was going to be feeling the symptoms forever and it was going to be uncomfortable and I was not going to be able to run, all of these things that go through your mind. It's just no, you just need to give your body more time. You need to do your exercises. I would say definitely meeting with the physical therapist helped me a great deal, because I'm an introvert, so I'm not the person that is used to talking about these things, but she made me feel so comfortable that I really, really felt so relieved. So that is a huge thing for me. And then obviously the exercises, knowing you have a path to follow and that this is going to help you recover and feel better, it's great.
There are so many themes of what Blanca just mentioned that really make me so happy because, I mean, she talks about validation, about her PT evoking a sense of calm in her. And also, the feeling that she's like, hey, maybe I'm not crazy. I mean, I feel like that's just so powerful. We kind of look for that in all areas of our lives. So I'm glad that, that could be her experience with her pelvic floor symptoms. And then she also brings up exercise. And so I wanted to kind of double click on that. Exercise is super effective for treating prolapse. What exercising does is it helps strengthen the muscles of the pelvic floor that have weakened and cause some of them to be less supportive to your pelvic organs. So exercise helps those muscles get stronger so they can regain their ability to do their jobs. And their jobs really are, one of them is to be supportive. Now, I know sometimes we kind of hate on Kegels because they get put on a pedestal in the pelvic health world. And, we always want to work to make sure that not everyone's doing Kegels for everything. However, with Prolapse, they're actually very, very helpful. And then there's also other strengthening exercises for your hips and your glutes that are really helpful too, like performing a Kegel with a bridge, for example. So those are some of the kinds of things that you might see if you're suffering from prolapse and you're working with one of our PTs.
I love that exercise. I love when we're able to kind of combine that pelvic floor strengthening with strengthening of another area of the body. It just like feels so effective if you're doing it too. It feels so supportive and effective. And this is actually one of my favorite conditions to treat, really, because exercise in education goes such a long way and can be really transformative. So let's get back to Blanca and really hearing about how these exercises have been helping her.
I feel like I'm leaking less and I haven't tried running again, but I like to dance, and I feel like that I tried to do that before too, and I felt like that heaviness again. But I have danced and I'm not jumping or anything because I cannot do that either. But I don't feel that anymore. And also I'm baby wearing sometimes, and I used to feel it when I used to baby wear a lot during the day, and now I'm not feeling it anymore. So I do think that definitely the exercises are helping. I'm trying to do them at least 3 times a week, but the Kegels, I try to do them every day because it's something you can do like in your daily life. Like you're sitting down at work and you remember and you're like, oh, okay, let me do my Kegels. But the complete like workout routine, I'm trying to do at least 3 times a week, sorry. I was surprised that there's so many things that you don't think are nearly related to pelvic health, and they are, like squats, or sometimes you have to do a lot of ab work, or there's like so many different exercises that I've done that have technically in my head they don't have anything to do with pelvic health, but they do. And it's awesome that it's like a complete approach. It's not just, oh, let's do some Kegels and that will fix it. No, it's like a complete approach to all of the pelvic health, and it's amazing. Yeah, it was surprising for me.
It is all about that comprehensive or complete approach. And the part of that I wanted to focus on right now was breath work. We talk a lot about breath work to really help calm down symptoms like pelvic pain and the nervous system in general. But understanding how breathing connects to your pelvic floor is also really important for pelvic organ prolapse. And that's because holding your breath when you're exerting yourself, like during a lift or when you're getting up from the floor, can place pressure down on your pelvic organs. And it's totally fine if this happens, once or twice or, whatever. But for many, they end up doing it a lot and over time, and that can contribute to their prolapse or even make their symptoms feel worse. So if you already have a prolapse, this can definitely be a huge component of your symptoms and maybe why they're flaring up.
Yeah, I love really focusing on pressure management with my Prolapse members when, starting off, because it can really make a huge difference. And Blanca already knew about breathing techniques from yoga, but the education component was an especially valuable part of her program.
I did know that I needed to inhale and inflate my belly and exhale and deflate it. And I didn't know that that would also help my pelvic floor, but it was awesome to learn it did. And I try to do it like a little bit more intentionally now while I'm doing my exercises or while I'm doing yoga, so it actually like also helps with that strengthening of the pelvic floor.
Blanca's story is really cool because it explains the way a lot of people dealing with prolapse feel, starting with that fear and maybe going on a little Google frenzy, but also how effective learning which exercise you need to do as well as how to breathe optimally can help so much. I think we need to give all new moms the opportunity to really tune into the pelvic floor postpartum, listen to their bodies and how they feel after having gone through pregnancy and delivery, just like Blanca did. She went on that first run and thought, something's not totally right. I don't feel, okay. And then she got the evaluation from a pelvic health PT to get things back to feeling a little bit more like she used to feel before. Next, we're going to go over our key takeaways. So the 3 most important things to remember from this episode. First, pelvic organ prolapse is when one or more of the organs in your pelvis, like your bladder, uterus, or rectum, slip down from their normal position and create a bulge or sense of pressure in your vagina.
Second, prolapse can sound really scary and even hard to talk about at times, but it can be treated. Pelvic floor exercises and education about the pelvic floor are a central part of that treatment.
Finally, you've heard us say it before, but PTs have seen it all. We are so ready to talk to you about prolapse, and we can even help you with some language and tools to use if you need to discuss your situation with another medical professional. You've also heard us say that taking care of your pelvic health is non-negotiable. It's just as important as any other aspect of health. So let's do a quick check-in on how we're taking care of ourselves this week. What's your non-negotiable right now, Kandis?
Rest. Rest is my non-negotiable. And I think that looks really different for everybody. And I'm trying to give myself grace because that might look different for me every day. But even if it's just like being okay with sitting on the couch for 5 minutes, I'm going to take that. I always feel like I need to be doing something. So even if I'm like sitting on the couch, I'm like, I need to be writing this list or doing that. I just want to be a blob on the couch for 5 minutes. And, I know I want to balance that with movement, and I will, but I'm going to rest this week. What are you working on this week, Bijal?
That's such a good one. Rest. Mine is that I tend to listen to a lot of podcasts and I watch a lot of TV that is kind of true crimey in nature. But I have a goal that I listen to one motivational podcast a week. So whether it's like something that's like about my career or about finance or something that might make me feel a little bit more positive about life versus the other things I listen to, that's my goal. So I did just listen to one on finance and I learned like some really nice foundational things like spend less than you make. It's so simple, but it's nice to just kind of have those reminders. So my non-negotiable now is I'm going to do my additional motivational one for this week, which I haven't chosen yet, but we'll see what it is.
Why is true crime stuff so addicting? I mean, and you sit there and you wonder, why do I have anxiety? It's because I'm watching this really terrifying thing. So thank you for that reminder. And thank you so much for listening today. If you'd like to learn more about Prolapse, be sure to check out the links in our show notes or send a message to your care team. Remember, if you're dealing with pelvic floor issues, you are not alone, and we are here for you.
The information contained in this podcast is intended to be used for educational purposes only and does not constitute medical advice or treatment for any specific condition. Please consult with your healthcare provider with any questions you may have about your medical condition or treatment. Check out our Hinge Health app library for new episodes coming soon.